Hi there. In this video we are going to discuss the different mediators of inflammation. So before going into the details of these mediators, I would like to tell you that we have to basically learn these tables by heart. If we have the knowledge of these tables, then we can easily describe all this what is written on the next pages. So this is our first table which describe principal mediators of the inflammation. So principal mediators of inflammation are histamine, prostaglandins, leukotrienes, cytokines, chemokines, platelet activating factors, complement system kinins. Kinins include bradykinin. So we have to learn their source and their action. So histamine is basically released from mast cell and basophil, and it induces vasodilation and increased vascular permeability. Prostaglandin is also released from the mast cell and produce same sensation, but in addition to this they also cause pain and fever. Leukotrienes are produced from arachidonic acid, and they also increase the vascular permeability and chemotaxis. And the cytokine, there are different type of cytokines, they are given on next, and they produce different responses such as they recruit leukocytes, they activate macrophages, they induce vascular changes and so on. Chemokines are involved in the chemotaxis, and platelet activating factors are involved in vasodilation and increase vascular permeability, and complement system produces different responses. So basically we have to learn this table by heart. So different mediators of inflammation are they can be produced locally, as well as they can be derived from different circulatory different part of circulation into the site of injury. And moreover, all mediators are produced in response to various molecules that stimulate inflammation. These can be microbial products, and these can be products released from necrotic tissue, and they are mostly short-lived, and when they die away, inflammation also goes away. And one mediator can stimulate the production of other mediators. So these mediators include vasoactive amines, which include histamine and serotonin. Histamine is basically involved in inflammation, while serotonin is not actively involved in the inflammation. And the role of histamine is same. It induces vasodilation and increased vascular permeability, and it is also involved in allergic reactions. Next we come toward arachidonic acid metabolites, and this arachidonic acid leads to the production of prostaglandins, leukotrienes and thromboxane. So this is basically arachidonic acid, which is cleaved from the cellular membrane, and it leads to two pathways, cyclooxygenase pathway and the lipoxygenase pathway. And cyclooxygenase pathway leads to the production of prostaglandins, which include prostaglandin G2, H2, I2, and thromboxane A2, and prostaglandin D2, E2. And the lipoxygenase pathway leads to the production of leukotriene C4, D4, E4, A4, V4, and this is basically a part of biochemistry. So different types of thromboxane, prostaglandins and leukotrienes are produced from the arachidonic acid, and their functions are given here in this table, and you have to learn this table by heart. So vasodilation is induced basically by prostaglandins, which include prostacylin and PGI2, prostaglandin E1, E2 and D2. Vasoconstriction is induced by thromboxane A2, leukotriene C4, D4, E4, which is the inverse response to vasodilation. And vascular permeability is increased by leukotriene C4, D4, E4. Chemotaxis is induced by leukotriene B4, and smooth muscle contraction is induced by prostaglandin C4, D4 and E4. Okay, so you have to learn basically their function from these tables, and in the next stage there are simply same details are given here, and there are certain pharmacological inhibitors of prostaglandin leukotriene, which include COX inhibitor, COX1 and COX2 inhibitor, non-selective as well as selective COX2 inhibitors such as celecoxib, as well as corticosteroid, which inhibit their production, and these are basically anti-inflammatory drugs which are used in treatment of various inflammatory diseases. Next come towards cytokines and chemokines, and in cytokines and chemokines there are different cytokines which are involved in acute inflammation, and there are different which are involved in chronic inflammation. In acute inflammation, most prominent cytokines are TNF, tumor necrosis factor, interleukin 1, interleukin 6, chemokines and interleukin 17, while in chronic inflammation interleukin 12, interferon gamma and interleukin 17 are involved. So you have to learn their sources and their function. Okay, these these cytokines perform different functions, from recruitment of leukocyte to induction of inflammation, as well as they can lead to the termination of the inflammation, and they can also induce fever, and they have varied functions. So you have to learn the function of each of these cytokines from here in the table. and when you have learned the table, you can describe these things which are written here. Then come here, chemokines. You have to learn basically if you have learned their name there, and give a general read through all this, which is enough for you. Okay, so how question comes here comes in exam from this part. Basically they ask to describe different cytokines. They will say write down 10 inflammatory mediators with their source and function, or they will ask you in MCQs such as they will ask to describe the function of to pick up the function of interleukin 6 from the MCQ, and so on. So in this way question is asked from this portion. So next comes towards complement system. So when it comes toward complement system is basically a network of complement proteins. So here is a flowchart of classical complement pathway. So in classical pathway, antigen and antibody complex activates C1. These are basically proteins and they are converted to active forms, and C1 is converted into C1 activated form, and then it further activates C2 and C4, and C4 2 then activates C3, and then it activates C5, and then it's C6 7, and then it will lead to zone and C8 9, and it's all combined lead to formation of C5 B 6 7 8 9, which is lytic complex. So different products are produced in this complement pathway. From C2, C4, C4-2 and C4A protein are produced. C4-2 activates C3 into 3B and 3A. 3B activates 5 into 5B, 5A. 5B activates C6, 7 into 5B, 6, 7, and these in turn activate C8, 9 to lead the formation of lytic complex. So these proteins perform different functions. For example, C3, C4 and C5. These are chemotactic proteins. They activate mast cell and basophil, and after they activate basically mast cell and basophil, and among them C5 is basically involved in chemotaxis, and C3b induces opsonization. Opsonization means it increases the phagocytosis of the foreign particles. And the last here is C5b 6 7 8 9 is lytic complex. Lytic complex, it causes the lysis of the microorganisms. So different products having different functions. C3 4 5 activate mast and basophil. C5 is involved in chemotaxis. C3b causes opsonization, and it is lytic complex which induces lysis of membrane. So this is classical pathway which is activated by antigen antibody complex. But this pathway can also be activated by alternate pathway, and this alternate pathway involves microbial products such as endotoxin or lipopolysaccharides which can activate it, and lectin pathway is basically activated by microbial carbs which directly activate C1. So these proteins perform different function in the inflammatory process. Next come towards the regulation of this pathway. This pathway is tightly regulated because if it goes unchecked, it can lead to the strong inflammation. It can damage the normal body cells. So it is regulated by different proteins which involves C1 inhibitor. This C1 inhibitor inactivates blocks the activation of C1, and if it is deficient genetically, it can lead to the hereditary angioedema. It is also a good university question. Decay secondary factor is decay accelerating factor and CD59, which are also proteins, and these proteins inhibit the formation of CD59 inhibit formation of membrane attack complex, and decay activating factor inhibits the formation of C3 convertase or activation of C3. So their deficiency can lead to paroxysmal nocturnal hemoglobinuria. And another factor is factor H, which is plasma protein, and it is cofactor for lysis of C3 convertase. So it also basically involved in activation of C3, and factor H is associated with deficiency of factor H is associated with hemolytic uremic syndrome. So this regulation or this inhibitor of the complement pathway are also an important university question. Other mediator inflammation involved platelet activating factor, which is involved in aggregation of platelet, and it's also involved in inflammation. Basically, platelet activating factor causes vasoconstriction and bronchoconstriction, and at low concentration it causes vasodilation. So it also has a role in inflammation. And then comes toward kinins. Kinins include bradykinin. Bradykinin increases vascular permeability and causes contraction of smooth muscle and dilation of blood vessel and pain when injected into skin. You have to learn basically their function. And neuropeptides include substance P and neurokinin A, which are involved in the pain perception and neurotransmission, and they can also increase vascular permeability to some extent. So you have to read this table too, and a function of different mediators here. So basically this topic ends here. So what basically you have to learn, you have to basically summarize this topic at your own in a good way. So first thing I will recommend is to learn all the tables here. You have to learn this table, you have to learn this table here, and then you have to learn this table here, and then you have to learn this complement system and function of different complement proteins, and then you have to learn the regulation of complement proteins, and then you can have a look at this table too. So basically you have learned the tables, and then you have to read this all this. It will end all here. Thank you.